A person with mental illness can be defined as someone with poor mental health. These persons usually have a cognitive, affective, or relational ability impairment as a result of genetic, developmental, or social factors. Mental health is a leading cause of economic burden equal to cancer care in the United States. Mental health affects 50% of Canadians over the age of 40 and 34% of young adults. In Canada, mental health burdens the Canadian healthcare system by $51 billion a year. With 1 in 5 people in Canada suffering with a mental illness, it's crucial to ensure people are able to access the services they need. This is incredibly important when considering the individuals that cycle through jail, halfway homes, hospital emergency rooms, the streets, and repeat, dubbed the frequent flyers that find themselves in the revolving door of mental health assistance services.
In Canada, the Mental Health Act brings burden for police officers when dealing with persons with serious mental disorders or PSMDs. Since police officers are liable for their care when PSMDs are apprehended, it is important for police to have a way of performing risk assessments and to accurately allocate persons with serious mental disorders to proper community support services rather than crowding emergency departments and hospitals. Some police services use ride-along mental health workers to allow for assessment through what is known as a Mobile Crisis Rapid Response Team program. However, today we will learn about an eHealth solution to mental health crisis today. Health.IM is a mental health screener used by police officers to help improve their response to mental health crisis situations. With on-site risk screening, transfer support, case management, supervision, and oversight, Health.IM is a comprehensive technical solution to dealing with PSMDs. With Health.IM, the amount of emergency department visits related to mental health can be mitigated, and police officer liability and time costs can be reduced, therefore providing higher quality care for PSMDs.
The system serves 3 major functions: to help police officers speak in clinical language, to provide a secure communication channel between police and healthcare, and to identify persons who are high risk in the community. The officers start by answering a series of questions designed to capture his or her observations in clinical language. The officer's observations are then condensed into an encrypted report, which gets sent from the police cruiser to Health.IM's cloud servers. Health.IM then distributes the report to all the appropriate healthcare partners in the community. The healthcare partners have software that allows them to decrypt the reports, and the nursing staff then review the contents. This makes it easy for the officers to describe what they observed that made them concerned, and allows hospitals to prepare for patients before they arrive with the police. All of the data captured by Health.IM is also uploaded into police records management systems. This data is made available to specialized mental health officers that can coordinate follow-up and support services depending on the patient's needs. The system watches for changes in risk or frequency of contact with police to alert the specialized officers to potential at-risk persons in the community. Finally, aggregate data is summarized and distributed in regular reports that help command staff identify trends in the community and potential training opportunities for officers.
Health.IM has been implemented in the Brantford community. A pre-implementation period occurred from January to September 2015, where data was collected about mental health responses. As shown here, 244 total calls were made, where 116 calls were apprehended and only 128 were diverted to mental health assistance services. The post-implementation period occurred from January to September 2016, where officers gained access to Health.IM in their vehicles. This resulted in an increase in the number of diversions to mental health assistance services, where for the 349 total calls, 111 were apprehended and 238 were diverted. As not every call I attend to is a known mental health event, it's often discovered through a police officer's street-level decision-making if a person needs to be apprehended due to a serious mental disorder. However, with Health.IM, risk assessment is made easier. Although police officers can use additional training in nearly every single area, using Health.IM can augment an officer's mental health analysis abilities.
Before Health IM, 2 officers dealing with an apprehension typically cost $937 per interaction. With Health IM, this cost can be reduced to $437 due to time savings, mostly due to reduced wait times in the emergency department. On the hospital side, wait times are reduced by up to 57%. This benefits both the hospital and officers, allowing officers to return to the streets to deal with other issues.
Overall, this means that costs of apprehension can be reduced to $22,000, while the hospital costs reduced to approximately $26,000, saving the taxpayers an estimated $238,000 per year.
Approximately 30% of officers find that gaining support from mental health agencies is a challenge to policing. However, a diversion increase of 86% made evident in the post-implementation stage of Health IM in Brantford saved around $51,000. This could translate to over $5 million per year province-wide. This increase can result in greater confidence in the public to reach out to Brantford Police Services or other services when undergoing a crisis.
It's really frustrating to be waiting in an emergency room when I know there's a lot of work to be done in the community. We have a revolving door relationship with the hospital, meaning we're always coming in and out of the emergency department. Sometimes I'll be with a PSMD in the hospital for up to 3 hours.
We try our best to get the police officers out of here as soon as we can, but there is little that we can do sometimes. Having people waiting in the emergency department that don't need to be admitted in the end is a waste of money and time. With Health IM, we can reduce wait times by diverting PSMDs to other community sites and by receiving advanced warning that the police are bringing someone in. We can print out the police officer's report using Health IM software. This helps us be better prepared and efficient.
One of the most helpful tools in working with hospitals is establishing formal relationships, and building those will be an important and potentially difficult task as Health IM expands in the future. But there are also other challenges that we must overcome.
As a community support worker, I hear about people all the time that don't have access to the mental health services they need. This is an even bigger problem for those living in rural areas. Rural areas are understaffed in psychiatrists and counselors. This makes it really hard for police to divert PSMDs away from emergency departments. Health IM proposes a solution to this problem by providing links to telehealth services such as the mental health helpline run by Connex Ontario. This way we can integrate psychiatrists and other health professionals to consult with police officers.
As someone with a mental illness, I turn to community support services for help. But one of the things I worry about is my privacy. I don't want people in my community to know about my personal information. Any mental health information collected through Health IM can be released in documents such as police record checks due to new laws. My information is securely transferred from the police records to healthcare facilities. Health IM encrypts all files and ensures my data remains confidential.
In the future, Health IM has many barriers that need to be addressed when considering the difficulties of implementing itself into other communities of Ontario, but it has fantastic opportunities to grow. Health IM will serve to bridge the gap between healthcare professionals and police officers. Future evaluations are planned for the Ottawa Police Service, York Regional Police Service, Cobourg Police, Waterloo Regional Police, Guelph Police Service, and Stratford Police Service in 2017. Thus, there's potential for Health IM to become adopted throughout all of Ontario at the various detachments and potentially all of Canada.